What is the most important step to improve kidney health? If you have kidney disease and your goal is to improve your kidney health, what is the most important step? What is the most crucial action to enhance kidney function? Is it eliminating protein from your diet? Or could it be preventing dangerous complications like anemia and fluid retention? Or is it treating the underlying cause, such as diabetes or high blood pressure? Should we first address the toxins that are harming our kidneys? Do you know which step is the most important? Let me know in the comments. Recent studies have shown that even patients in stage 5, the final stage of chronic kidney disease, CKD, can still improve. However, when it comes to dealing with kidney issues, many patients feel confused. They feel overwhelmed by everything happening to them: dietary changes, doctor visits, medical tests. There is so much new information to learn, and it is not easy. Not everyone finds the right answers. So today, I want to make sure you are on the right track. The question we are answering today is crucial both for newly diagnosed patients and for those who have been battling kidney issues for years. Let's examine these 4 possible answers and tell me which one you think is the most important. This is a very important question. You cannot improve your kidney function if the step I am about to discuss is not taken. First step: eliminating protein from the diet. Is this the right answer? Let me know what you think in the comments. We know that excessive protein intake can harm the kidneys, and many patients have seen improvements simply by adjusting their diets. A diet too high in protein for a patient's CKD stage is linked to metabolic acidosis, high blood pressure, increased risk of diabetes, and, of course, rapid kidney function decline. So, if your answer is eliminating protein, you are not entirely wrong. All these answers are partially correct, however, only one of them is 100% correct. An even more important step: managing complications. Complications are all the conditions caused by kidney disease, including severe issues like anemia. Kidney function cannot improve without first addressing anemia. Some complications of CKD can even be life-threatening. Uremia, for example, occurs when the kidneys can no longer filter toxins. These toxins accumulate in the body, preventing multiple organs and systems from functioning properly. Metabolic acidosis is another complication that can lead to hospitalization. We also see heart disease on this list. Kidney disease can contribute to heart disease, which is actually the #1 cause of death worldwide. So, is managing these complications the right answer? Just like reducing protein intake, this is only partially correct. While addressing complications is essential, not every CKD patient experiences them. Some patients are fortunate to be diagnosed in stage 3 and may even prevent these complications from occurring. Thus, this is not the correct answer after all, because there is one item on this list that is essential for everyone. Have you guessed what it is? Is it dealing with toxins, or is it treating the root cause of the disease? If at any point you think you know the answer, write it in the comments. Only 2 steps left. Is the right answer managing toxins? Managing toxins is clearly important when it comes to dealing with kidney disease. Patients with end-stage kidney disease are placed on dialysis precisely because their kidneys can no longer remove enough toxins. There are many ways we should address toxins daily. For example, CKD patients are more vulnerable to risks associated with heavy metals and pesticides found in our fruits and vegetables. Since toxins primarily come from the breakdown of dietary protein, it is clear that reducing toxin intake should be a priority. Not to mention, processed foods often contain excessive amounts of phosphorus or sodium, which is also crucial to consider. I know many of you have reported excellent results when using fiber-based acid binders as a detoxification method. This can be one of the easiest ways to help the kidneys. So, is managing toxins the correct answer? Not entirely, because I have saved the most important step for last. The correct answer: treating the underlying cause. If you answered correctly, congratulations. You know more about health and medicine than most people, and that's fantastic. But if you answered incorrectly, don't worry, as we have seen, the other steps are also important. But why is treating the underlying cause the most critical step for improving kidney function? The reason I consider addressing the root cause to be the most important step comes from a study published in the journal PLOS One titled "Kidney Function Can Improve at Any Stage of Chronic Kidney Disease." I have talked a lot about this study over the years because it truly changed everything for CKD patients. In fact, this study proves that patients in stages 4 and even 5 of CKD can still improve. This is incredible. But the reality is that most CKD patients do not improve. What happens to people with CKD is that they lose kidney function day after day, year after year. So why do some CKD patients improve while most do not? This study also found the key reason why only some patients improve. As we can see, the most crucial factors that made a difference between those who improved and those who did not were related to the underlying cause of CKD. Blood pressure was the #1 treatment target in this study, followed by proteinuria and diabetes. We are all taking blood pressure medications and possibly metformin or insulin for diabetes. So why aren't we improving? One reason is that many medications used for people with CKD are also hard on the kidneys. ACE inhibitors and ARBs are clear examples. As the study we just saw pointed out, the fewer blood pressure medications used, the better. This is not controversial. Research has been conducted to determine whether stopping ACE inhibitors and ARBs entirely is better for patients than taking them. Those who did not take blood pressure medication fared worse, but not by much. Clearly, we need something better. In fact, patients who have been observed to improve their blood pressure and blood sugar levels through lifestyle changes and natural choices often show significant improvements in kidney function. So, to answer the question, why do some patients improve while others don't? Because to improve, you need to take care of diabetes, high blood pressure, proteinuria, and similar conditions, but you need to do it naturally. I really want to share with you the best ways to take care of diabetes, high blood pressure, and proteinuria naturally because that is the most important step toward better kidney health. There are certain natural methods that can reverse kidney disease with results that have amazed me. Would you like to see them? Let's start by looking at what really works for diabetes. Let's talk about diabetes. When it comes to kidney health, improvement isn't possible unless we address the root cause of damage. It's no secret that nearly half of people with CKD have diabetes. If you have diabetes and your goal is to protect your kidneys naturally, controlling your blood sugar should be your top priority. Keep in mind that the supplements we'll discuss today are not intended to replace any medications prescribed by your doctor, but they will help. They will be effective and will help you reduce your dependence on medication. Perhaps the most powerful natural supplement for diabetes today is berberine. Berberine is a natural compound found in the berberis plant and other herbs, and many experts consider it to be the most potent supplement available today. Some primary care doctors are even beginning to recommend berberine before prescribing medications like metformin. Berberine has been extensively studied in people with diabetes. It may have similar effects to metformin on blood sugar levels but with less strain on the kidneys. berberine is extremely powerful. This supplement can significantly lower fasting and post-meal blood sugar levels. It can also help with cholesterol and blood pressure, so consider using it if you have diabetes. This supplement is taken 3 times a day, 500 milligrams about half an hour before meals. So yes, berberine is amazing, not just because it can produce results similar to prescription medications, but because it does so with fewer toxins affecting the kidneys. There's another herb you can add to make berberine even more powerful, banaba. This plant is known for enhancing the healing properties of berberine. Banaba is a tree native to the Philippines and Southeast Asia. Its leaves are used to treat diabetes, and when combined with berberine, the results are astonishing. A recent study tested this combination on 148 patients compared to a placebo. After just 3 months, 34.3% of patients taking banaba and berberine had returned to normal blood sugar levels. As an added benefit, this combination of natural supplements also aids in weight loss, which is how patients can further improve their blood sugar status. By the way, this is important. When you lose enough weight, you don't need to continue taking medications or supplements to maintain your improved condition. If you want to try a banaba supplement, check for its chloroxylic acid content. It should be listed and should not be lower than 2%. Clearly, when it comes to naturally managing diabetes, diet is also extremely important. So if you want to learn more about how to eat to protect your kidneys from diabetes. Now, we've seen a combination of supplements that can surprise you when used to treat diabetes. Let's now look at something that is also effective for high blood pressure. High blood pressure is even more common than diabetes in people with CKD because CKD itself can cause high blood pressure. This is why taking action against high blood pressure is essential for almost every patient. If your goal is to improve kidney function, keeping your blood pressure below 130/80 is crucial. This can be achieved with medication. Remember, having a blood pressure below 130/80 with medication is still better than having higher blood pressure without it. So, the goal here is to keep blood pressure under control with as little medication as possible. This is extremely important if our goal is to improve kidney function and eventually see GFR levels increase. How do we do that? First, let's look at a little-known tea that can produce amazing results for high blood pressure. It's called hibiscus tea, and it may be the most effective tea available on supermarket shelves for lowering blood pressure. It helps the kidneys eliminate excess water and toxins and also combats high blood pressure. A 2015 review of 5 studies published in the Journal of Hypertension found that drinking this delicious tea could reduce blood pressure by up to 7.58/3.53 mmHg, which is truly remarkable. Even more effective for high blood pressure may be magnesium supplementation. This works because many CKD patients are deficient in this essential mineral, especially those also taking vitamin D, diuretics, or proton pump inhibitors. Low magnesium levels can cause high blood pressure. So imagine having to take one or more medications to manage a condition that other medications are causing. Another thing I highly recommend for blood pressure is garlic. It has been used in people with hypertension to reduce systolic and diastolic blood pressure by an average of 8.3/5.5 mmHg. It can also help lower cholesterol, reduce inflammation, boost the immune system, support diabetes management, and more. Last but not least, when it comes to high blood pressure, vitamin D is essential. Everyone knows they need to supplement with vitamin D when they have kidney disease, at least, I hope so, But did you know that vitamin D helps with high blood pressure by inhibiting the renin-angiotensin-aldosterone system, RAAS? This is very similar to what RAAS drugs, also known as ARBs and ACE inhibitors, do. However, research also shows that the blood pressure-lowering effects of vitamin D supplementation don't work for everyone. I mean, it's a vitamin, perhaps it only works for those who had low vitamin D levels to begin with. I wonder who is known to have chronically low vitamin D levels. You guessed it, kidney disease patients. And that's all for today. Thank you for watching. Wishing you all the best. Goodbye.